Infants are much more prone to middle ear infections than the older child, or than the adult. And the reason for this is predominantly due to the anatomical changes that occur as a child develops. The most significant changes are that of the craniofacial structures that go through a huge growth during the first 7 years. At birth, the cranial base of the infant is basically flat. However, as the baby develops, a number of changes that occur that are particularly relevant to the osteopath. The most significant change is that the head elongates, the palate drops away, and the angle between the eustachian tube cartilage and the skull base increases. The most significant changes relevant to the manual therapist are as follows. First of all, compared to the adult, the infant's eustachian tube is much shorter, providing less protection from the secretions of the nasopharynx. Second of all, the proportion of cartilage to bone is much greater in the infant, making the eustachian tube more floppy and less stiff. As the craniofacial bones develop, the proportion of bone to cartilage increases in the older child, making the eustachian tube stiffer and less vulnerable to the secretions from the nasopharynx. Finally, the angle of the tube in the child is much smaller, such that the cartilage, the osseous portion, the pharynx and the middle ear are all in a straight line, whereas in the adult, the cartilaginous portion of the eustachian tube is angled inferiorly. If you look at the diagram, you can see that the infant's tube is directed at an angle of 10 degrees from the horizontal, whereas the adult is directed at an angle of 45 degrees to the horizontal. In the adult, this makes for a much more effective clearance of the tube, as it has gravity on its side to help drain the eustachian tube. Another theory is that since the eustachian tube in the child is more horizontal, this affects the relationship between the tensor palatini muscle and the cartilaginous portion of the eustachian tube, making the tensor palatini muscle less efficient at opening the tube. These are just some of the reasons as to why infants have an increased propensity to otitis media relative to the adult.